Hi, good evening, everyone, and welcome to tonight's COVID-19 Community Town Hall. I'm Steve Elmer. I'll be joined shortly by my colleague and co-host, Dr. Kelly Kam. We're both college professors and members of the Health Research Institute here at Michigan Tech University. We want to give a warm welcome to all of our viewers out there that are watching on Facebook Live and on the Zoom webinar, and all of the listeners tuning in on 97.7 The Wolf. It's great to have you with us here tonight. Our town hall will focus on lessons learned during the COVID-19 pandemic. We started our town hall series in September of 2020. Tonight is as I mentioned, our 20th town hall. And so we thought this would be a great opportunity to take a minute to reflect on some of the lessons learned. To do that, we have a panel of experts here tonight, both local and regional experts from here in our area and downstate, to share some of the professional lessons that they've learned, provide insight, analysis, and also importantly, answer some of your questions that you have. And I see a couple of questions coming in here from our chat already. Hello to the listeners and viewers that are joining us from downstate. Really briefly, our community partners that have made this COVID-19 Community Town Hall Series possible include UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, along with their Iron Area Health Foundation, the Physiological Society, and the Michigan Health Endowment Fund. We appreciate their support, along with the support from the Health Research Institute. Briefly, their mission is to support health-focused research, education, and outreach here in the rural Upper Peninsula. The goal of each town hall is to help increase awareness about all things COVID-19 and how it impacts your health and the health of society at large. Just want to remind everyone that all of our town halls are recorded. They are archived on our website. You can go back and watch them or encourage others to watch them. Our website is mtu.edu/health-research. Once you're on the page, go ahead and click on Town Hall. We've covered a broad range of topics, including last month's Town Hall that focused on dealing with the Delta variant. And our town halls are also rebroadcasted on the subsequent Sunday at 12 p.m. Eastern on ABC 10. So with those announcements and updates, I want to go ahead and pass it over to my colleague, Kelly Kam, who is an epidemiologist by training. And she's been an active voice here for public health on our campus and in our community. So Kelly, welcome. It's good to be working with you tonight. Can you give us a brief overview of what to expect and who will be here with us speaking?
Absolutely. It's great to be here. A year into our town halls, and now looking at 20, close to 22 months into the pandemic that we've been facing here. So a lot of things have changed. We've learned a ton. We still have a lot of learning left to do, but we're excited to share with our viewers here 5 different panelists to talk about from their perspective what we've learned and where we can move forward into the future. So we have Pete Berry from our local health department, the Western UP Health Department. He is the Director of Community Planning and Preparedness, to talk about how public health has changed and will continue to change to meet the growing needs and the changing landscape of our world. And we have Carl Meingast, who's the operations manager for Michigan Tech's COVID testing lab. So many of you, if you've been on listening before, have learned that we here at Michigan Tech have a COVID testing lab that was set up and started running and testing samples both for our Michigan Tech community as well as the wider Upper Peninsula community. So he'll be talking from the lab perspective of how we've learned and how we've managed to keep moving forward with that and testing thousands and thousands of samples for our community. We have John Clements, who's an assistant professor from Michigan State University. So we're bringing in another university here, who's with their MPH program. So that's a Masters of Public Health program in the College of Human Medicine. And he'll be talking about, from a societal perspective, what we've learned from past pandemics and whether we've applied them very well to this pandemic and how we can learn in future pandemics. And then we have 2 people speaking on different sides of the misinformation perspective. So from a scientist perspective, and we're excited to have a journalist on as well. So we have Eric Patusiak, who's an assistant professor here at Michigan Tech in Cognitive and Learning Sciences. He also has a connection to Michigan State University as an adjunct professor there in the College of Human Medicine. And he'll be talking about the trust in science and communicating science from a scientist perspective. And then we have Joshua Vissers, who is a self-published journalist with the Late Edition, and he will be talking about it from the journalist perspective. So we are excited to have all of you here. Thank you so much for joining us, and I'll give it back to you, Steve.
Okay. Well, Kelly, we appreciate the introductions, and we often start our town halls with just a brief public health update before we turn it over to Pete from the Western UP Health Department. Did you have any announcements, any updates on case trends? Because I know folks also are tuning in for some brief updates there too.
Sure. So like I mentioned, we're almost getting close to 2 years into this pandemic now. It is not over by any means. Some of the data is looking slightly promising. We'll keep our fingers crossed. Some of our case trends for the United States are starting to dip, just slightly starting to dip here in Michigan. They are actually still looking like they're going up. And locally here, we're seeing pretty much kind of a leveling off. The unfortunate thing is that we are leveling off still at a very high transmission rate. So when we look at some of the guidance from CDC and our local health department on how we need to manage it, mitigation policies that we should be doing as individuals and within our community, like mask wearing, we are in a high transmission, which does mean that in indoor public settings, everyone, regardless of their vaccination status, should be wearing masks to make sure we're trying to lower the case transmission as much as possible.
Okay. Thank you, Kelly. We'll circle back and talk to you throughout tonight's town hall. And I know, as always, you help me manage the chat here and field any questions. Just want to remind our listeners a couple ways to send in questions tonight. If you are joining us on Zoom, you can use the Q&A button at the bottom. We welcome your questions. Will try to sift through those and direct those to the appropriate panelist. If you're out there listening on the radio or on social media, you can email those to us at townhall2020@mtu.edu. So with that, I'm going to turn it over to Pete Berry from the Western UP Health Department. Pete, good to see you again, and thanks for being with us.
Thank you, Steve. We always appreciate with all the speakers that you have access to and opportunities to talk to invite your local health department. So we appreciate that. I'd like to echo Kelly in saying pandemic's certainly not over. So we're going to talk about lessons learned, but it's kind of a lessons learned in the middle, in the first quarter and the third quarter. Not really sure, but it's lessons learned nonetheless. So from a local perspective, we've got a lot to choose from. There's a lot of logistical things that we've been through. Whether it's running mass vaccination sites, whether it's running mass testing clinics, call centers. There's a whole variety of things. So we have a process that we have to do. When you end an emergency, when you get any kind of government funding, you have to submit something called an after-action report. And there's this very specific Homeland Security evaluation protocol that you have to follow when you do that. And it really gets into the nuts and bolts, lessons learned, very minutia of things we can work on. I really didn't think anybody cared about that tonight, because that's very not interesting. So I picked a couple of things that we've learned through this pandemic when I actually took the time to stop and think. After getting this invitation, about things that we really need to work on going forward, kind of the big view, but still coming from the trenches of local public health, so to speak. So the first one is about communication, and it's communication. If you've ever read an after-action report, they always talk about communication. It's always something that comes up, but this is a little different spin on it. Historically, local health departments are doers. People who come to local health departments, they're nurses. They want to vaccinate. They want to, work on healthy babies, keeping pregnant moms healthy. There's a whole lot of things they want to do. Inspectors want to go out and, issue permits. There's a lot of things that we do, a lot of stuff that we, you're out there actually creating a product or doing something. So there's been a change when we look at how this has evolved through the pandemic, because local health departments have really become information agencies. And we became information agencies a long time ago. I don't think we really ever thought of ourselves in that way. So there's something called Public Health 3.0, where it talks about local health departments as the community strategist and how we need to take that helm when it comes to, the strategy for health in your community. And it all makes sense when you stop and think about it. But fundamentally, day to day, that's not something that we typically spend large swaths of time working on, because there's so many other things. So when we look down the road, 5 years, 10 years, we really realize through this pandemic and through some of the things that other folks here on the panel tonight are really going to talk about, that we need to get better at how we deliver information, how we consume information, how we prepare information. Because we spend a lot of time every day here, advising. We spend a lot of time interpreting information, explaining data. pointing people to where they can find information. And we ran a call center for months where we had several people kind of locked up in our basement. That's all they did was just explain things and interpret and give people guidelines. So one example I kind of use is we have a grant that we recently wrote, and one of the things that kind of spilled out as we talked about that is the concept of enhancing or improving the public health IQ of our community. And as we do that, as we attempt to do that, we really have to look at strategies long term, how we can improve how we engage with the public and really kind of change our infrastructure internally. So the lesson learned, the takeaway number one for us is, how do we shift and get a lot better at that piece, that communication piece? And it's much further than just hiring a public information officer. It's kind of a rethinking and re-strategizing long-term how public health functions in the community. The second one is, it has to do with chronic underfunding of public health. And this isn't a pity party for public health. Since 2003, since I entered the profession, we've been chronically underfunded. A story, I walked off of a college campus and into a local health department, and my first job, they told me, well, this job is probably only going to last 6 to 9 months because we don't have a lot of funding. We're probably not going to be able to hang on to you. How are you with grant writing? I was 22 years old. Grant writing wasn't exactly on my resume. So my entire career and well before I started in public health, it's been chronically underfunded. There's always been the mantra, do more with less. And then there was us coming to grips with the reality of doing less with less. But when there comes an emergency, whether it's a small emergency, medium emergency, whatever you want to call it, we wear a lot of hats. Everybody has to do a lot of different things. The pandemic has taught us something really important, is that when you are wearing all those hats, you don't have the opportunity to take advantage of funding, take advantage of resources that might come your way in a larger emergency. So we're built to contract. We're built to shrink because that's all we've done for the last 20 plus years is shrink and contract. So when an emergency comes along, we don't have the infrastructure built in to take advantage of additional funding or additional resources that come our way. So we really have to build into our plans ways to take advantage of those things and quickly put funds, resources, et cetera, into the hopper and get them online. We have things called continuity of operations plans that help us work through what happens if you lose staff or if you have a building that's now unusable. We have no plans to rapidly utilize additional staff, additional funding, or additional resources. So that's something that we've never really thought about because it's never really been something that's been on the table for us. Rapid hiring plans, rapid resource development, planning into our systems. These are things that we need to work on, and it's a big lesson learned that we have to take home. So what are we doing about it? Well, right now, you got to think about this as an adjustment at halftime. If you take the football analogy, you tweak what you're doing at halftime. You don't put in a whole new defense, right? So you have to work in the margins while you're in the middle of the game. But we really want to look at the opportunity in the off season to look at this, reflect, and keep these ideas close at hand, so we can move forward in a substantial manner to make these lasting improvements and improvements that are really going to matter. Because we've seen shortcomings and things that we've struggled with. Every local health department in the country, frankly, has struggled with these two things. And we need to work to kind of fix that. So that's kind of where we're at in terms of the big picture. Just a couple of things. There's a whole Easter basket filled with things that we could have chosen from, but those are two that I thought might click with the group and with the other panelists that we have tonight.
Okay, thank you, Pete. I'm just going to remind folks, if you do have questions, you can send those in a couple different ways through our email or through the Q&A button at the bottom. Pete, just going to lead off with a question getting to keeping the community informed. You talked about the public IQ. Do you see any opportunities to collaborate with whether it's universities or nonprofit health organizations in the community to help bolster some of those, whether it's resources or help build some infrastructure here in our rural Upper Peninsula?
And those are the types of things that we need to do more of, and we need to do better. Those collaborations are currently right now we have something called Copper Country Strong, which was built up after the Father's Day flood, and it's currently managed and updated by the Porch Health Foundation. So that already is a very good collaboration, but we need to take that further and further and continue to do those sorts of things. But it's something that's happening, but I feel like it's happening on a level that could be enhanced significantly over time.
One other question here, Pete. I think it's somewhat related to a lesson learned. Lots of information coming out, including that on boosters. Do you have any insight or updates on boosters for adults and when they might be available here locally in our community?
So boosters, the availability of boosters for those who are 65 and up that are seeking a Pfizer booster is that's something that's going to be available here imminently, and Moderna shots, the boosters for those we still don't have any information in terms of when exactly that's going to happen. So it depends on the product that you're looking for. And it really depends on the age of the person. If you have underlying health conditions, there's a whole suite of conditions that you can get a third dose. There is some difference between the terminology they use. So when they say booster or when they say third dose, that's something important to kind of keep your eye on too if folks are looking on the internet for guidance. But if you're 65 and up and you are seeking that third dose of Pfizer vaccine or booster, or contradicting myself, right? Not that it's not confusing. That's something that you can call your local providers about now and get yourself set up.
Okay, thank you to Pete Berry from the Western UP Health Department. We're going to keep things moving along. I'm going to introduce Carl Meingas. He's here with Michigan Tech University, the laboratory and operations manager for our COVID-19 testing lab on campus. So Carl, welcome to the town hall.
Yeah, well, thanks for having me, Steve and Kelly. And thanks for giving me the opportunity to reflect on this past year, I guess at this point, probably 20 months. Yeah, so just a brief overview of what I've been doing the last year. I defended my PhD at the beginning of COVID, the spring of 2020. I started working shifts in the COVID testing lab in the summer of 2020. And in December of last year, December 2020, I became the operations manager. And I've been kind of overseeing the lab up to that point, or up to now. And in that time, this lab that Michigan Tech's put together has run over 35,000 PCR tests for the Western Upper Peninsula. We've provided a variety of different testing services, I guess you would say. We've taken a large portion of the testing demand in the community for the Western UP last fall and spring. Michigan Tech has had their own surveillance testing program in place during that time. Long-term care facilities were using our lab to do their surveillance testing. And so I've kind of seen a lot of these different applications of tests and kind of how the test's value is in the different applications. And so I think one of the things, I have three things, and two of them are really things I'm grateful for. So the first thing that I'm just grateful for is that over these 20 months we have two different testing EUAs or protocols that we use to run COVID PCR tests, and both of those have stayed very valid and very robust through the whole pandemic, and we've seen multiple variants and waves of these variants now, and it was never a sure thing that our tests would stay valid this whole time. And so that's something I was just thinking back on. It's just, geez, whoa, I'm very grateful we didn't have to reinvent the wheel, I guess, so to speak, and validate new tests while we were running at maximum capacity. And so that's something I was very grateful for. One, I think probably the most important thing that I've learned and, would be applicable, next season, as Pete was saying, would be just how important the speed of turning your tests around is. I can't overstate that fact that when I started working in the lab, we all knew it was important to get these tests turned around in a day or 48 hours at the max, because people were waiting on these tests, and there was maybe anxiety related to their test being pending. But the more you learn about the epidemiological side of things and the contact tracing, the more you realize that it's really being able to get test results rapidly keeps us ahead, or maybe just at the heels of the virus. And if we're turning tests around in 4 or 5 days, that's just not going to cut it. You're getting too far behind the spread of the virus, and people's contacts are having new contacts, and it's just not, it's not doing its job. And I also think being fast with tests increases the compliance of people. So I think one of the biggest issues in this pandemic is, people's willingness to do the right thing, maybe. And so I think, having fast turnaround times increases people's willingness to get tested, and that really increases the utility of testing, because you start testing the right people, you start testing more of the different parts of your population, and testing becomes much more effective. And I think being fast helps increase that compliance. So that's probably the main takeaway that I have from the last year. And then I guess one more thing that I wanted to just touch on, it's kind of a plug, but I wanted to say thanks to our testing lab staff and really everyone in healthcare. I think, it kind of was one of those, you can do anything for a year kind of scenarios, looking at the start of this pandemic, and at this point last year, we're seeing the vaccine trials successful, and these vaccines are extremely effective. And I definitely, in my mind, it was like, okay, we can get to that finish line. And the finish line just wasn't really there, I guess. Hopefully it's coming, but we don't really know where that finish line is. And, it felt like we were, running the 100-meter dash at this point last year, and we're still running. So I just want to say thanks to everyone that has been, still grinding away, running these tests, and they're still important, and we're still, kind of the eyes in this pandemic. So that's all I had.
Well, thank you, Carl. We certainly need to commend you and your team for everything that they're doing, not only here on our campus, but as you mentioned, in our rural community. And I'm hoping you can speak a little bit more to that. I don't think every rural community has a COVID-19 testing lab right locally. Can you talk a little bit more about how this was set up in the first place at the onset of the pandemic?
Yeah, I mean, it's a miracle. I think Karen Fay has been on here talking about it, but yeah, I mean, I have to quote Karen and say it is nothing short of a miracle. I think the state reached out to Michigan Tech early in April of 2020, and kind of was their question was, well, we have this kind of lack of capacity in the Western Upper Peninsula, and do you have the ability to kind of put together a PCR testing lab? And it was kind of a call to arms, I think, at Michigan Tech, and all of these people with different backgrounds in PCR or RNA extraction, or our medical lab science program that kind of knew the clinical side of things. Everyone kind of got together, and within a matter of weeks, we had this lab that could intake samples securely, into a secure database where the patient information was safe. That's been a huge thing from a research side of things, as we were not ever prepared for what is involved with handling that kind of patient health data. And then once those samples are brought in, running RNA extraction, PCR, and then reporting the results, that we were capable of that in weeks, which is quite the feat. So I guess hopefully that answers your question.
Yeah. Thank you, Carl. And I just want to welcome in Kelly here for a minute. Could Kelly, you speak to a little bit about the importance of the testing here on our campus for our students? We just want to remind students that it still is ongoing. It's at no cost to them. Could you just tell us a little bit more about the services here available for our students, as well as our staff and our faculty?
Yeah, so we do have testing available, and you caught me with not knowing which days of the week, because I think it's 3 days of the week.
It's Monday,
in the
Tuesday,
morning.
Monday, Tuesday, Thursday.
Thank you, Carl. Monday, Tuesday, Thursday from 9 to 11:45, so that our students can get to class for their 12 o'clock class, because that's important for them to get to class. It is walk-in testing. Anybody who is part of the Michigan Tech community, employees or students or dependents of employees and students, are able to come in and get tested. The samples go to the Michigan Tech COVID lab, and you'll get those results very quickly.
Great. And if Kelly, if folks are off campus in the community, what are some locations that they can get to and get a test quickly?
So absolutely. So if you have a provider here, you can contact your local care provider. Our urgent care clinics, Aspirus, Upper Great Lakes, UP Portage, all have testing capacity available. And I believe you can also get tested at Walgreens. A student informed me. Can anybody confirm that, if that's correct?
They do have testing available there. It's something it comes and goes depending on supply, but it is possible.
And the health department also has new testing available, correct? Antigen testing.
We have antigen capabilities at the Water Street Clinic in Hancock. The National Guard comes on Thursdays. It'll be Thursdays through the end of October. And those are available between 8 a.m. and 6 p.m. The National Guard will run an antigen card. It's walk up, no appointment necessary at that Water Street facility.
Well, thank you to Pete and Kelly. Going to keep things moving on. Before I introduce our next speaker, I just want to welcome anybody that might just be joining us, perhaps listeners out there on 97.7 The Wolf. We are live here, of course, on the radio and also on Facebook Live and on our Zoom webinar. If you'd like to see some of the visual content, if you go over to thewolf.com, you can click on the links and see us in person here, at least virtually. Next, it's a pleasure to welcome in John Clements from Michigan State University and their School of Public Health and the College of Human Medicine. So John, welcome to our town hall and thanks for being here.
Thank you very much. It's a pleasure, and I've enjoyed listening to other speakers ahead of me, so interesting information. I am coming at this from really the context of a historical look at what's happened in previous pandemics. I teach biostatistics and I teach research methods in the MPH program, but I was asked to develop an elective for our students that really looked at the ideas behind what do we do when a pandemic hits, but clearly we're focusing it on COVID-19. Unfortunately, this will not be the last pandemic. And so we talk about, public health systems and law and ethics. And one part of the class that gets the most sort of enthusiasm is when we talk about social and cultural issues. I'm a trained sociologist. I'm interested in these things. I'm interested in how, politics and religion informs people's views of things. So I started teaching this class and students wanted to know more about the history. So a little bit, bubonic plague, so 1340s. The initial reaction was that this was a punishment from God and that we needed to punish the people that brought it about. So, Jews were slaughtered at that time. Nowadays, we can see that other groups of people are targeted because of, their race or ethnicity or nationality. But at the time, healthy people isolated themselves. Doctors stopped seeing patients. People moved to the countryside, markets closed. This was the 1340s, right? So now we're at 2020, 2021. Same thing's going on. Some of the things that happened during the bubonic plague and later outbreaks, people on ships. So sailors would come into port and that's how it was spread, fleas on rats on ships and boom, it spread. And so they started keeping people on the ship for 30 days. It was called the Trentino. This was in Italy. Then they increased it to 40 days, a quarantine, right? They started contact tracing of people that got off the ships and figured out where they were going. So none of this is new. This is, 700 years old, proven public health interventions that work. So that's one lesson I learned, is that this is not new. Another thing I learned is about vaccines. So smallpox vaccine didn't happen, officially until 1790 something. But during the Revolutionary War, they were still vaccinating troops by, using people that had smallpox and then cutting their skin and putting some in. There's a really great biography out about George Washington, and it explains basically how once they started doing that with troops and they weren't losing troops to smallpox, they could get enough people in the army. So if it weren't for that, we'd probably still be speaking English, but we'd have an accent, right? So we won the war possibly because of vaccines. So if you want to be patriotic, go get your vaccine. That's another thing I learned. Spanish flu. So this is also really interesting. During the Spanish flu, we see a lot of the same things that are happening today. Public health recommended quarantine and isolation of sick people, covering your mouth, wearing masks, not getting on mass transportation, closing down things, closing down, mass gatherings. And so we're seeing all of that. And there was reluctance to that then. So this is, again, nothing new. We know that the public are going to, say, hey, I don't want to do this. But one of the really interesting things that came out of it was a study from 2007. And investigators from CDC and U of M looked at 43 large cities across the US during the Spanish flu and found that these cities that instituted these public health measures earlier or that instituted them more often and on a regular basis had lower mortality rates. The peak of their mortality hit later and the peak didn't get as high. So we know these things work. We learned it 100 years ago, okay? This has been around. Another interesting thing I learned, or another take-home lesson, is in 2019, Johns Hopkins came out with the Global Health Security Index, and it looked at how well countries were prepared to respond to public health emergencies, including pandemics. The US was number one. They were number one in prevention of the emergence of release of pathogens, early detection, rapid response, robust health systems, commitments to improving national capacity. Number one in the world. Where we fell short was we were ranked number 19th in the overall risk environment and country vulnerability. And in that section, they highlighted political insecurity, social unrest, and public health vulnerabilities, which would just make you fail. 2020 was the perfect storm for those things. So you can be as well prepared as you can be on paper and with systems, but if you have social and cultural issues that are not working in your favor, you're probably going to fail. Another great take home. So students are really interested in what we can expect from the future. With the Spanish flu, there was some great research that came out again, I think in the early 2000s. So people were thinking about pandemics before this happened. It's not like we hadn't been without them. We had SARS and MERS and other things happening. So 2006, researchers, I forget from where, sorry, but they looked at what happened to birth cohorts during the Spanish flu. So what happened to children whose moms were pregnant with them during the Spanish flu? They had lower educational attainment, lower lifetime income and SES, more disability. These are kids that weren't even born yet. And so when we look forward to what's happening with children today, we should expect that throughout their life course, they're going to need help. We can expect that. It's happened. We know that it's happened. This is not conjecture. This is true story right here. What happened after the Spanish flu? We saw labor shortages. It's happening today. We saw increased wages. What's happening today? And we saw increased use of social safety nets. Same thing happening today. If you can get social safety nets to actually be put into law and funded, right? So if that continues, then you're going to see that. We can expect that we will continue to see disparities in outcomes for racial minorities and ethnicities. It's happened already in the state of Michigan. We were at 4-to-1 for cases and deaths between minorities and whites. So for every one white case, we'd have 4 at the beginning. Because of the response by the state with a task force to look at these disparities, that's changed to 1-to-1. But the death rate, the mortality rate for minorities to whites started out at 4-to-1, it's still 2-to-1. And a lot of the reason is because most essential workers are minorities. And we know that minorities have higher rates of things like heart disease and diabetes, which have become 2 of the most prevalent conditions that also influence health outcomes for COVID. So lots of things that we really are expecting in the future as far as disparities. We're looking at lower life expectancy. We're looking at continued economic downturns. We're looking at continued economic struggles for people. None of these are surprises or will be surprises. It's happened in the past. and we can expect it in the future. So I guess my biggest take home lesson that I've learned in this last year and a half is that we know what's going to happen. We need to learn from our history and act on it. And we do a poor job of it sometimes. So that's my spiel.
John, that was a very fascinating snapshot of your presentation that you gave, I know, earlier on during the pandemic. A quick question here that came in. Based on the waves of transmission from the 1918 Spanish flu, I know you've looked at those data. There's been research that has come out. How close does that match or mirror the multiple waves that we're seeing, over 100 years later during the COVID-19 pandemic? Could you comment a little bit about that? Because I know our listeners and viewers haven't seen what you presented a couple of months ago.
Yeah, it mirrors it exactly. So there was a good article that came out, within the last 10 years, but some epidemiologists from Michigan State and the epi department looked at what happened during COVID, and they found 4 waves. And you could probably make the argument that the timing of the waves for the Spanish flu in 1918 and the timing of COVID are almost exactly the same. And they're almost the same types of peaks, right? So we had, when this first happened, right, in March of 2020, and we had that peak and we're all like, oh man, this is terrible. And then a few months later was the second peak, which was 10 times what the first peak was. That's what happened with the Spanish flu in the state of Michigan. So, as it is right now, I guess maybe you could argue we're in our 4th wave, maybe, and so that's sort of what it looks like. But by all accounts, and I'm not an infectious disease expert, but this won't go away, right? It's not going to go away. It's going to become endemic. We'll have little outbreaks as we move along, things will happen, which is why we really need to think about these public health measures that work. If we have an outbreak in a region and we can quarantine people and mask and test and contact trace, we can prevent it from blowing up elsewhere. So, that's I think the take home.
Thank you, John. I just want to loop Pete in here. Pete, you were on our first town hall, I believe, back in September of last year. And one of the phrases that you used was old school public health measures. I don't know if you remember that statement, but that really stuck out to me. And I think John has just reinforced that 1 year later, not only from the Spanish flu, but you said over 700 years ago. So any reflection on your part, Pete?
No, it's just those old school public health measures, as he described, they're tried and true and they work. And they're low tech. I mean, the vaccine development, certainly not low tech. The testing, certainly not low tech, but distancing, tracing, those types of things, pretty straightforward, pretty simple.
Thanks, Pete. We are just a little over halfway for our COVID-19 community town hall. Our topic is focused on some of the lessons learned during the pandemic and even some of the lessons learned from previous pandemics. Our next speaker is Eric Patuszak. He's an assistant professor here at Michigan Tech University. So Eric, welcome to the town hall. Tell us a little bit more about your topic tonight.
Yeah, thanks. Thanks, Steve and Kelly, for having me on. So my kind of background and research interests lie on the intersection of cognitive psychology and public health, where I aim to improve informed decision-making through different types of informational strategies. So I also teach medical students and residents how to conduct and critically appraise research studies, which is an ongoing issue. So I'd first just like to start off by reading a little paragraph from a publication by Kevin Eskindone that in July that came out that summarizes the current state pretty well. So misinformation and disinformation come in endless guises and spread via different mechanisms, including campaigns of persistent inaccurate beliefs and falsehoods, deceptive messages, and engagement echo chambers. The pandemic has brought a paper tsunami with widespread misinterpretation of both peer-reviewed research and preprints, press releases without scrutinizable data, sensationalized media reporting, and endless conspiracy theories. As a result, finding trustworthy sources of information and guidance on the COVID-19 has been difficult for the public. Over the past months, logical fallacies and cognitive biases have relentlessly distracted from critical appraisal and transparent communication of the scientific evidence related to COVID-19. Confirmation bias, availability bias, motivated reasoning, the Dunning-Kruger effect, black or white fallacy, straw man fallacy, ad hominem fallacy, appeal to emotion, appeal to ignorance, and appeal to authority fallacies have all run rampant across social media. So what have we learned about improving trust in science and preventing the spread of information? So as many psychologists would say, like, it's messy, it's complicated, and it depends. However, many sciences have the tools to help us understand these uncertainties and develop solutions to help solve these complex problems. So the kind of cumulative research to date has uncovered some ways in which disinformation can be countered. The take-home message from this research is corrections, fact-checking, or debunking are frequently only partially effective. And the effects of misinformation linger even if people acknowledge a correction or their information was debunked. And B, inoculating people against misinformation or pre-bunking, as the term has been coined, by alerting them to how they can be misled before they encounter misinformation is a promising approach. So for example, if we show people how spreaders of misinformation are using impersonation, emotion, polarization, and discrediting opponents are tactics to spread their messages, people can learn these tactics and spot them and limit the spread. On the other hand, we do have massive amounts of good information. So how do we make sense of all of this? One way is to look for evidence on both sides of the issue, not just the side that confirms your viewpoint, and look for replication or triangulation with different groups or in different areas or by different methods. Meta-analyses are an approach that kind of pools and combines results of various studies, and can help us give us a better understanding of the overall effects and the uncertainty in those effects by looking and pooling various studies together. Meta-analyses are not without their limitations, and there's a common saying that with this method is the garbage in, garbage out. So you need to pay attention to the studies that are included, the differences in design, and the participants used. And finally, I think we should understand the underlying roots of the expressed attitudes of others, yield to those values, and then align messages accordingly. So I think a lot of the things like John talked about, being culturally sensitive to some of these historical issues and truly understanding what's happening. So for example, if someone is hesitant to vaccines, it may be because of overall distrust in institutions, not because they're not aware of the science. So I think overall for me, I have kind of five take-home points and lessons learned. Conveying uncertainty and talking about what we don't know is really important to improve trust. Seek to inform and not persuade. Look for evidence on both sides of the issue and signs of replication or triangulation, and adjust your beliefs accordingly. Expertise, honesty, and good intentions are key to trustworthiness. Researchers need to demonstrate all three. We can't expect to be trusted on the basis of expertise alone. And finally, and maybe most importantly, spend time to seek understanding of others' perspectives. Or as the one saying goes, seek first to understand and then to be understood.
Thank you, Eric, for your overview. Can you tell us a little bit more about the nature of science and how it does change and evolve? I know that that's been one of the issues with it being in the public spotlight. Sometimes information's coming out, seems like it's changing rapidly. Can you just speak to that? Because with our public audience, we have people from a wide range of different backgrounds.
Yeah, I mean, simply having that awareness and understanding that things can change and will change, and that's the nature of nature. Taking isolated or individual studies and seeing that as truth is difficult. We need to see more studies that are replicated in different groups using different methods to really kind of solidify those claims. So yeah, part of it, and it's hard to be patient, but as time will tell, more data will come in, different people will be doing it. So I think that should work.
Okay, I want to bring Kelly in here for just a minute. Kelly, I know there was a question about preprint. Eric mentioned a preprint study. Could you raise that to Eric or maybe John as well?
Sure. So oftentimes, if I would just do a Google search and look for a study, there are oftentimes things that come up that will say that it's a preprint. So John, if you could kind of clarify the difference between something that's a preprint versus maybe even a pre-publication versus a published study.
Sure. So I've put a paper on a preprint server myself, so I'm somewhat familiar. So the idea is that preprint services came about so that more people could put their research out for the public to look at. One of the criticisms of published literature is that a lot of the times what you find in there are positive results and the reaffirmation of what people were looking for. And so one of the things with preprint servers is that any researcher could put their stuff on there, negative results, positive results, and then basically the group can decide how great it is or not. But this is not the same as peer review. And so once things undergo peer review and they're accepted, they can be published in a journal. It's sort of the stamp that says the wider scientific body approves of this. There are all sorts of problems with peer review, but that's generally how it works. So when you find something on a preprint server, you can know that yes, somebody did the work, but no one has said, hey, this meets the standards of what we would say you could get for publication in general. And so if something is eventually from a preprint server, it undergoes peer review and is published, you might want to look at it a little differently. If it undergoes peer review and time and again it's rejected and it's not published, it lives on in a preprint server, sometimes without ever having the knowledge by anybody reading it that it had undergone peer review and had been rejected. So there's some caveats you need to be aware of when you're looking at preprint stuff. You might always want to go and see whether it's been published elsewhere. Many preprint servers, services, they track it through. And so if it's published, they'll eventually be able to tell you that it's published. But if it's not, it just sort of languishes there.
We appreciate it, John. And this is a great segue into our next speaker. I'm going to welcome in Joshua Vissers, who has a background in journalism. So Josh, welcome to the town hall and tell us a little bit more about yourself and the lessons that you've learned professionally over the past 20 months.
Yeah, well, and actually something that I realized is I moved to the Keweenaw area just over 3 years ago. And I realized that more than half the time I've been up here, we've been, under the COVID-19 pandemic now. But really, I'd like to really, thank Eric for almost teeing me up here, because what I'd like to highlight real quickly is some of what has made, this extra step of double checking your sources so necessary. And it also actually has its roots quite a while in the past. One of the big things is the fairness doctrine. It was instituted in 1949, but then repealed in 1987. And it was an FCC rule, not a law. So it was simply put in place and then repealed by the FCC commissioners. And there was no public vote or really involvement at all. This only applied to television and radio broadcasters because they were the only ones that held FCC licenses. And it basically said they had to spend some of their time covering issues of public interest, and that they had to do so equitably. And basically the reason that they applied that to these TV and radio broadcasters is they considered the airwaves to be public property. So they said, if your business is going to use these public airwaves, then you have to use some of your time for the public good. But that was repealed in 1987. And so now they can basically use those airwaves more or less however they want. And we've seen at least some broadcasters and cable news included, although they weren't part of the fairness doctrine, kind of start to march towards more partisan positions or more biased positions where they aren't necessarily showing multiple sides or telling the news with equity at all. Also in 1987, the World Wide Web debuted. And this, over the course of a couple decades, eventually led to social media. And social media has really taken away the gatekeeping power of reporters. It used to be that if a scientist or a politician or a business leader wanted to speak to the public, they had to come to a reporter or a television host or someone who had kind of the keys, so to speak, to these mass broadcasters and to these large audiences. But now they don't have to anymore. They just jump on Twitter, Telegram, Parler, Facebook, and they can send a message straight to however many people are willing to listen to them. And if a reporter wants to try to fact check them afterwards, they're always kind of chasing at their heels. And even if they are able to keep up with the speed of fact checking that's necessary to do that, it's hard to reach that same audience because it's not like the politician is going to be like, oh yeah, sure, post your fact checking on my Facebook. I really appreciate it. So the reporters and fact checking have in a lot of cases been cut out of the information cycle. And so that's what's placed this responsibility back in the hands of the news consumer. As much as I'd like to be able to, highlight which sources are good and which sources aren't so good for everybody, like, reporters used to be able to do, it's not really within my power anymore. So, when you're trying to teach something in a short amount of time, an analogy is good, right? And I like to use a food analogy, news diet, so to speak, because now you're in control of your own news diets. It used to be we were all kind of like students eating at the school cafeteria, and we had employees of the school and rules that made sure that if you're going to fill your plate, you'd at least get some vegetables or some fruit on there somewhere. You might get dessert still too, but something healthy is going to make its way onto your plate. But now we're eating at the Cheesecake Factory, and we have a menu of hundreds of items, and the waiter doesn't care, and they'll bring you nothing but a stack of French fries if that's what you order. So you have to be conscious of what you're eating, what you're ordering, and your diet. Don't overeat. Consume as much news as you feel like is good for you. Turn it off. Go do something else. And that's coming from a reporter. I'm telling you, don't read too much news. Be conscious of where your news is coming from. Check that byline. Is this on a website that you've read before? Do you recognize this website? Do you recognize the name of the person that wrote it? Do they have a byline on this article at all? And really, ultimately, it's just if you're conscientious of what you're consuming, sooner or later you're going to find the tools you need, like what Eric highlighted, to find the healthy things that you should be consuming.
Josh, question here to start things off. What can educators and scientists do to work with you and reporters to help better get some of the correct information out there for the public? Is there ways that we can work better together?
Yeah, the first thing to understand is there aren't enough reporters right now. So we're all stretched a little thin. The big thing is, like, I love if you see like a Facebook meme or something comes across your feed and you're kind of angry about it, it's so wrong, send it to me and I'll fact check it and I'll share it with my audience. And, again, I can't necessarily reach the same audience that meme has reached, but at least I can, get it to my audience and say, hey, maybe you've seen this around Facebook, it's been circulating, 300 people liked it or whatever, but the facts are this, and here's my sources, and here's this. I just don't have time to browse Facebook all the time. I know there's lots of garbage out there, but I don't, you can spend all day, browsing through everything out there. But if there's something that really bothers you as a scientist, especially if it's something within your expertise, so you can be the source for the debunking of this, absolutely reach out to a reporter. I very much consider fact checking and debunking that misinformation part of my responsibility.
Josh, we really appreciate it. We, of course, know that there is a call right now by our U.S. Surgeon General that all of us, including reporters, journalists, educators, researchers, and community members to work together to make sure we're articulating, getting the correct information out rather than the misinformation. So we appreciate you being on and doing your part. And certainly if I come across something, and I know we've talked before, we'll certainly connect and make sure we emphasize the correct information.
Yeah.
We have about 5 minutes left here in our town hall. I just want to go around to our different speakers here and give them an opportunity for just a takeaway. If they had one lesson or one take-home message for our viewers and listeners tonight, what would it be? And Pete, we'll start with you since you went first here.
That's a tough one. One take-home message. After listening to everybody talk, I think the biggest message is, take what you want to hear, take where you get your information, take those things seriously, and listen to all these other folks that are experts in this field. Because I've had a lot of people call me over the last 2 years and ask me a lot of questions and a lot of things, and I oftentimes wonder, where did some of these ideas come from and where did they start? And nothing I can say to them oftentimes will help. So people really have to take the reins on this stuff and figure out how to get to that right information.
Thank you so much, Pete. We'll go to Carl next.
I think my sister would make me say this, but get vaccinated.
Okay. Thank you, Carl. Let's go to John next.
So I'll do it quickly. I read a really interesting quote today, and I thought it really stuck home with how we're dealing with everything today, that we're so divided. It says, America has long equated patriotism with the armed forces, but you can't shoot a virus. When all is said and done, perhaps we will recognize their sacrifice as true patriotism, saluting our doctors and nurses, genuflecting and saying, thank you for your service. Perhaps we will finally understand patriotism more as cultivating the health and life of your community. Maybe the demilitarization of American patriotism and love of community will be one of the benefits that come out of this awful mess. And I can only hope that that's the case. So.
Okay, thank you, John. We'll go to Eric next. Your take-home message for our audience tonight.
I would say, seek understanding and don't be afraid to have tough conversations.
Josh, how about you?
I just, thank you for including me on this panel. And I guess I'd just like to reiterate the news idea, the news diet concept, which is, be mindful of what's on your plate and where it came from.
And I'm going to let my colleague Kelly Cam wrap up here. Kelly, we have a little over a minute to go here before I conclude with some final announcements and remind folks of our next town hall. So what have you learned working on the town hall series the past year, and or your takeaway message tonight?
So I would certainly say we need to be kind to each other and recognize that there are a lot of people working a lot of long hours and not necessarily being recognized for all the work that goes into protecting our communities in this. And I think that we've been able to really highlight a lot of those people and the fields in that public health is not only our public health department. They are key and they are important and we need to treat them with respect. But there are many, many other people that go into this. I think from my perspective, I'd like to reiterate what Carl had said. I did the contact tracing team for Michigan Tech, and that was an amazing group of about a dozen tech students that just were superstars in protecting our community and and especially our tech community. And the amount of effort that everybody's been willing to put into this has been just amazing.
And Kelly, one quick follow-up question for you. When we started our town hall series last year, did you anticipate that we'd still be at it here a year later?
No, I thought I'd be back to my normal life of teaching and research, but I'm glad to keep doing it and help our community.
Yep. Well, that's a great segue. Our next town hall, just to remind folks, we're on the final Thursday of every month. So we'll be back October 28th, talking about all things COVID-19. And certainly we'll fill you in on specifics as we get a little bit closer. I want to sincerely thank all of our speakers tonight for volunteering their time, coming on here and providing information, sharing the lessons they've learned professionally and answering questions along the way. We really appreciate it, and you're welcome back anytime. Pete, I think you've been on here 3 times, and kudos to the health department. You and your colleagues have been on here. I counted, I believe, 5 times now. So thank you for everything that you're doing here. And finally, thank you to the listeners and the viewers out there for doing your part to stay informed. We had questions here locally from Marquette County, down in the Traverse City area. So it's great to have you with us. Have a great rest of your evening, and we'll see you in about a month on October 28th. Take care, everyone.